Hey everyone, welcome back. Today we're going to be talking all about blood pressure. So first let's start by talking about what is blood pressure and why is it important. Blood pressure is the pressure of the blood against the arterial walls. It is produced during contraction of the heart muscle as blood pumps through our circulatory system. It's important that we monitor our blood pressure and maintain normal blood pressure to help maintain optimal cardiovascular and circulatory health. An elevated or abnormally high blood pressure is what we call hypertension, and this can lead to serious health problems such as a heart attack, stroke, aneurysms, heart failure, or even sudden death. Hypertension is also known as the silent killer, and the reason that we call hypertension the silent killer is because oftentimes people will have high blood pressure and not even catch it until it's too late and it's already done some serious damage to the heart. So how do we record blood pressure? Our blood pressure is actually recorded using two important numbers, your systolic pressure and your diastolic pressure. Your systolic pressure measures the force of blood against your artery walls while your ventricles are contracting or squeezing. And this is when we're pushing the blood out of the heart and to the rest of the body. This systolic pressure is always going to be recorded as the top number when we're writing down our blood pressure measurement. And this systolic pressure is the first sound that you hear when you're manually recording blood pressure using a stethoscope and blood pressure cuff. Your diastolic pressure is the bottom number, and this is the force of the blood against your artery walls when your heart relaxes and the ventricles are able to then refill with blood. This diastolic pressure is always going to be the bottom number when recording blood pressure, and it's the last sound that you hear when you're listening through the stethoscope recording manual blood pressure. What is considered normal, elevated, or hypertensive blood pressure? Normal blood pressure is actually less than 120 and less than 80. It's a common misconception that normal blood pressure is considered 120 over 80, but as you're going to see here, 120 over 80 would actually put you in the high blood pressure category under the new blood pressure guidelines. The normal blood pressure needs to read less than 120 on the top and less than 80 on the bottom. So a perfect example of this would be 116 over 76. Elevated blood pressure is when your systolic, your upper number, is 120 to 129, but your diastolic is still less than 80. So an example of this might be 122 over 76. High blood pressure or hypertension actually has two different stages, stage 1 and stage 2. Hypertension stage 1 is when your systolic number, that top number, is anywhere between 130 and 139, or if your diastolic number is somewhere between 80 and 89. So an example of this would be 132 over 82. Hypertension stage 2 is when your systolic number is 140 or higher, or if your diastolic number is 90 or higher. So an example of hypertension stage 2 could be 144 over 94. But you could also say that an example of hypertension stage 2 is 134 over 94, because having that diastolic pressure that is over 90 automatically puts them in the hypertension stage 2 category. Hypertensive crisis is when you need to consult with your doctor immediately and get medical attention. Hypertensive crisis is measured when the blood pressure reads higher than 180 over higher than 120. And this could be a combination of either your systolic being higher than 180 or your diastolic being higher than 120, or a combination of both. There are two different types of ways that we can measure and record blood pressure, manually versus electronically. Manually recording blood pressure involves using a stethoscope and a sphygmomanometer, also known as a blood pressure cuff, and this type of measurement will be the most accurate if done correctly. This is the best option in a clinical setting. There you can see on the bottom, on the left-hand side, is an image of a blood pressure cuff and a stethoscope. The electronic way of measuring blood pressure, you could use a wrist monitor or an arm monitor. And these types of electronic blood pressure devices are available for both the clinical or in-home setting and are great for patients who are having to monitor their own blood pressure themselves or for medical staff who are checking patients' blood pressure very frequently. At the bottom here, you can see an image of one of the at-home blood pressure monitor systems. And on the right-hand side of the screen, the one on the stand is something that you would more commonly see in a clinical setting. Okay, now we're going to watch this video that demonstrates how we manually measure and record blood pressure.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to demonstrate how to check a blood pressure manually. First, you'll need to perform hand hygiene and gather your supplies. You'll need a stethoscope and a manual blood pressure cuff. So let's measure a blood pressure manually. To do that, we want to make sure a patient is sitting down with their arm at heart level and their legs are uncrossed. Now, if they're lying in bed, you would want to make sure that this arm is at heart level. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And you want to make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff, it can throw off the reading. And what we're going to do is we're going to palpate the brachial artery, because this is the artery we're going to be listening to get our blood pressure. Systolic number, which is that top number, and this is the first sound we hear. And then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points, because it's going to tell us our systolic and diastolic number. So what we're going to do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're going to find it, and it is located here. And we're going to look on our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that this arrow is pointing in that direction of where that artery is. So you're going to put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now, the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension, because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff while feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low-pitched noises. So we're going to place that over the brachial artery. Do it lightly. Don't fully compress it, because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. Okay, it's 104. And we're listening for that last sound. And it was 78. So the blood pressure is 104 over 78. Then once you have your reading, make sure you fully deflate the cuff full of air, and you're going to take the cuff off of your patient, of course, and clean it if it's not disposable, and you will document the blood pressure, and what arm you took it in. Now, what are normal blood pressure readings? According to the American College of Cardiology 2017 updated guidelines, a normal blood pressure is a systolic less than 120 and a diastolic less than 80. Elevated blood pressure would be considered a systolic of 120 to 129 and a diastolic less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic 80 to 89, and hypertension stage 2 would be a systolic greater than 140 and a diastolic greater than 90. Okay, so that is how to check a blood pressure manually.
And here we have a list of step-by-step instructions on how to perform manual measurement of blood pressure, a step-by-step clinical skill checkoff page. If you need this, you can pause here.